Good afternoon, everybody. I feel like I should be dancing onto the stage after that sort of music. Good afternoon. Welcome to this session. You have chosen wisely. You know this already. This is our session on scaling up refractive error services. And I'm going to introduce you to a fantastic cast. But before I do, for our simultaneous translation, we're on channel 1. That's M1. I think channel 4 is Mexico City FM lunchtime show. It's very good as well. But we're on channel 1 for tuning in. So thank you. Can I say how grateful I am and how grateful we are to our friends at Restoring Vision for their help in sort of helping us curate this session, really, is what I would say. And we're delighted to be joined by the chief exec of who will speak to us shortly, but I just want to acknowledge her support, and that, of course, is their chief exec is, of course, the brilliant Pelin Muniz. Welcome, Pelin. Thank you very much for your help. And I don't really think these numbers do. They are worth repeating, aren't they? More than 1 billion people around the world are not able to see clearly or at all, and over 670 million of those are due to uncorrected refractive error. So the point of our session today is to think about what's happening and how we scale it up. So we're really grateful to you all for being here, and to you for your questions as well. Let me just tell you who's going to be presenting, and I'll guide us through the session. Delighted to be joined by Moises Cifren. Moises is an administrator at the Good Samaritan Hospital, La Romana, and is based in the Dominican Republic. Welcome, Moises. Thank you for being here. Next to Moises, Connie Palos is Director of Strategy, Communication and Fundraising at Ver Bien para Aprender Mejor, which I think means seeing well to learn better. Okay, muy bien. Thank you. Welcome, Connie. Thank you for being with us. Samrana Yasmin is the Deputy Technical Director for Eye Health at the legendary organization Sight Savers. Always good to see you, Samrana. Thank you for being with us. And of course, it's another annual reunion for me with the brilliant Jacqueline Grove. It's always good to see Jacqueline. Jacqueline, you will know, is the President 2020 Quest and Executive Director of the Coalition for Clear Vision. Welcome, Jacqueline. And we will be beaming in through the magic of technology, Matthew Bell, who's the Director of Frontier Economics based down in sunny Cambridge in the United Kingdom. So Matthew, if you're out there, thank you in advance for beaming in your messages. So we know that addressing refractive error is incredibly key to our vision for 2030 insight. And really what that boils down to is scaling up what works. And that's what we're here to reflect on and discuss. So, Pelin, I wonder if I can invite you to our lectern just to really set the scene and get us thinking. Everyone give a warm welcome to the stage to Pelin. Welcome.
Good afternoon. Thank you all for being here. I'm really delighted to be here with you to speak about a topic that I think is really critical, especially at this moment in our sector's momentum, which is about scaling up refractive error services. So why is scaling up so critical and important? Globally, at least 2.2 billion people have near or distance vision impairment. And of these, about 1 billion, almost half of the cases, vision impairment is either could have been prevented or is yet to be addressed. This is a staggering reality that really underscores the need for collective effort and accelerated action to scale up services to solve the vision crisis. When vision is restored, lives are reimagined. Clear vision transforms not only how people see, but also how they live and interact within the world. The impact of our work lies at the intersection of global health, education, livelihoods, and economic development. It also contributes to many of our progress towards many of the UN Sustainable Development Goals and the global targets to achieving refractive error coverage. The recent Thrive study showed remarkable increase in income gains, 33%, for people who received a pair of reading glasses and were conducting near vision work. This is quite remarkable. And at Restoring Vision, we recently conducted an impact assessment with 60 decibels in Uganda, and we also found huge increases in quality of life, independence, confidence, which I'm most excited about, and improved ability to work. Again, these results are quite impressive. So our challenge now is meeting the demand and achieving the ambitious global targets. How can we and how will we scale up to meet the WHO SPECS 2030 goal to increase effective refractive error coverage by 40 percentage points by 2030? This is a big leap we're going to have to take to get hundreds of millions of people in glasses. So refractive error, we believe, is a solvable problem if we all work together. And let me share a little bit of what Restoring Vision is doing. So at Restoring Vision, we've been scaling presbyopia programs since 2015. We prioritize cost-effective delivery models, and we also work at the community level with organizations who already have established trust with the members that they serve, and that's very critical. We also work to ensure that our programs are very cost-effective, and in our case, we can reach an individual with a pair of glasses and vision services for $2. Since Restoring Vision was founded 20 years ago, we've reached 28 million people in 150 countries. Last year alone, we reached 4.3 million people with eyeglasses, and this year we'll reach 5.5 million people with eyeglasses. And now we're building pathways to scalable and transformative growth because it is urgent matter and it is really needed. So we currently unveiled our new 3-year strategic plan, which aims to reach 10 million people annually by 2026 or sooner, we'd like to think. And then with a second growth scenario to reach 50 million people, and we think we could achieve this by the year 2028. This is a very ambitious goal, as are the global targets, but we also think this is very achievable through our partnerships, through effective mobilization of resources, and also strengthening of systems. Driving advocacy and engagement are also key. Due to our collective efforts with all of you here and many others, we now have refractive error and eye health very visible on the world stage, and that is quite an achievement. At Restoring Vision, we're playing an instrumental role in international advocacy and action to solve the global vision crisis. So I'm really proud to be sitting with IAPB and also at the level of the UN Friends of Vision Secretariat, as well as the World Health Organization's Global SPECS Network, advancing the SPECS 2030 initiative, the IAPB Refractive Error Advocacy Group, and the Coalition for Clear Vision Steering Committee. And earlier this week, we were so pleased to hear that IAPB has set up a refractive error strategy implementation group to help drive the efforts forward even further. These global organizations and these initiatives are really critical if we're to make real progress on achieving our goals. And I hope that you're involved in these organizations, and if you're not, please ask us how you can be involved. Also, bringing global attention through media and PR are really critical. I was really delighted to have the opportunity to collaborate with the very prestigious Community Eye Health Journal on an article that shines a spotlight on presbyopia and also the global need for urgent action. There are copies available of this issue. You can get them on your way out. And it covers refractive error, and it also covers our piece on presbyopia and why it matters. We believe that solving refractive error in the world is a very doable problem. There's a lot of issues going on in the world, but we think this is one that can be solved. I really look forward to collaborating with as many of you as possible to help move the needle forward. We have a lot of work to do, and I'm confident that we can achieve it together. I'm also very excited for you to hear our incredible panelists, very accomplished individuals who can share with you how they're driving action and also scale within their organizations and initiatives. So thank you so much. I hope you enjoy the rest of the session. Over to you, Ali.
Thanks, Pellet. So, Pellen, as you retake your seat, I am drawn to that word, and it was so high, wasn't it? High 90 percentile of improved confidence. Just remind us why that matters so much and what that in turn unlocks. Yeah, I think we should be. Hang on. Sorry, thank you.
Oh,
Yeah, it should be on. All right,
Okay,
thanks, Ben. Thank you.
wonderful. Thank you. We know that in the case of vision loss, sometimes it's gradual, as in the case of presbyopia, and we know how it can impact a person's life. At Restoring Vision, we've seen people come to vision clinics crying because they haven't been able to work and provide for their families, and it's quite extraordinary. So when you restore vision and people have an opportunity to do the things that they really enjoy doing, to be able to take care of their daily tasks, to work again, it's incredibly meaningful. Confidence increases, mental health improves, and so much more.
100%. Thank you. Right, now we're not going to bombard you, that's the wrong word, but we're going to inspire you with some case studies. And the first one is going to be delivered by Moises. And really why we're so honored to welcome Moises Sifren to our stage is because this is a model. It is about scaling refractive error coverage through government primary health clinics and outreach in the Dominican Republic's most vulnerable communities. So please welcome up to the lectern, Moises Sifren. Welcome, Moises.
hello. It's on. You hear me?
Yeah.
I always ask, what you want me to speak? Haitian Creole, English, or Spanish? Spanish, okay. I will go English. I live in Dominican Republic. As many of you know, we share the island with Haiti. Haiti is the poorest country in America. My parents are Haitian, so I was born in the Dominican Republic 55 years ago. So our job is to bring hope to many of those communities, and we work on both countries, even when we are in Dominican Republic. This is where I work. This is the Good Samaritan Hospital, which is on the east side of the Dominican Republic, next to Punta Cana. Many of you have been in vacation in my country. So we are 40 minutes from Punta Cana. So we do our best to make reading glasses distribution and other goods distribution, like rear shares, medicine, and everything. So this is the Good Samaritan Hospital. I know you can read that. I'm not going to read. I will just talk to you. So we do have like a very good system that is working for the reading glasses distribution. Even when we are a Christian-based organization, we work with everybody. We work with non-profit, we work with the government. Our government have a very good system where they have primary care clinics where the patients go to get reading glasses, vitamins, medicine for impartation and other goods. And what is good about this, that's our system. The government already have the doctors. So we lower the cost of the distribution because we are using the system. Here is a photo of how we do it. You see all the reading glasses, but also you see other medicine. You see prenatal vitamin in the other side. So it's how we are doing the job in Dominican Republic, so we can bring a better vision to the people who are in need in my country. Here is Dominican Republic. It's a beautiful island, don't you think? But in this side, it's Haiti. I have only the map of my country. You see those numbers? They are the primary care clinic that we have. So in every province, we have a number of those small clinics where we do our best to bring the reading glasses. So whenever the reading glasses get, like I live here in La Romana, we have 22 primary care clinics. So our job is to get the reading glasses there, and then the distribution is easy. Also, we work a lot on the border. All this side is the border with Haiti. So we have partners who make the distribution and all the goods, including the reading glasses, and also we are helping the Haitian. In the east side, we have the biggest sugarcane refinery in the Caribbean. And many of the Haitians who cross the border, like my family, go to work on the sugarcane fields. maybe the sugar that we are using, the coffee today, come from my country. And because we have this special attention to the Haitians in Dominican Republic. Here we have a very strong and good education component. And we thank Restorative Vision because we do have agreement with, our hospital have agreement with 3 major hospitals in Santo Domingo, in the capital, where they send the 3-year and 4 years residents, ophthalmologists. You see, those doctors, they come and spend 3 months in our hospital, and using them, we make the distribution, and we actually get some patients who not just need a reading glasses or a distant glasses. Also, they need cataract, and those doctors make the cataract operation in our hospital every Wednesday. But no way for us to get this without this collaboration with those hospitals in my country. Here we have the clinic. Those clinics are especially for those living in the villages. The villages is where the Haitians live. In Dominican Republic, we have 11 million people, and we have another 1.5 million that are Haitian, and half of them live on the east side of the Dominican Republic. So we organize medical clinics every week, and we go and bring medicine and the reading glasses, and we change many people's lives, especially the Haitians living in my country. That's it. It's simple. The message that I want to leave with you, that we have to use everybody to make the distribution. Sometimes, as we are a church, we have some church-based organization, they just want to work with the church. If we have a organization who work with sport, they want to work with their people. No. You have to use everybody to make the distribution. The Good Samaritan Hospital is using the government, including the politician. Sometimes they want the credit, we don't care. They say, we are giving you these reading glasses, we don't care. They take the credit. We just want the reading glasses change the people's life. And believe me, sometimes they ask us, do we gonna have any credit? Because if we make the distribution, we say, yes, go ahead. But when you see the smile of those patients who need the reading glasses, the credit it's nothing. We use Rotary Club, in our country we have about 65 Rotary Club. We use all of them for the distribution, because the Rotary and the Lion Club, they already have a structure in the country, and they have reputation in the community where they live, and we use them to make the distribution. We use all the Catholic churches, the Presbyterian churches, the Baptist churches, which is good that sometimes the churches don't get along, but when we are making good to people, we get along. Maybe it will happen to you in your community. I mean, even when we think differently, but when it's the situation is helping the people, we get together. So I have 30 seconds. I'm Dominican. Dominican talk a lot. So I have to finish today. But I want to leave you with this message. Don't worry. If we have to use drones to make the distribution of those reading glasses to change people's life, please do. If you have to talk to anyone that you don't like and you speak different language, don't worry. Do good to people, do good to people, do good to people. I finish on time. See you later.
Thank you, Moises. First class. Thank you. I'm actually going to pass you back the microphone just to say that was excellent. Funding matters. Money is important. Apart from money, what's an example of something that would help you and your organization scale up your work?
I would say, we know the distribution costs a lot of money. That's why we partner with everybody. We have people on the border with Haiti who just come to the east side of the Dominican Republic. They pay the transportation, pay the staff to come and get the reading glasses from the hospital just because they have the credit. It's amazing how Restorative Vision and other entity just send the glasses and the medicine to us. They never ask us, Moses, you gotta give us credit. They are making the reputation of the Good Samaritan Hospital stronger in Dominican Republic. So we are doing the same with the partner.
Yeah.
So it's a very good way to lower the cost, sharing the cost with other people who want to do good.
It's a really powerful point that sometimes that cash cost can disappear if you reframe it as a partnership across. Is there a type of organization right now that you would like to work more with? Obviously, it's a great partnership with Restoring Vision, but perhaps in other sectors, who would you like to come ringing?
I would say we want to, working with my conscience, visiting other hospitals, they have a ton of needs, medical equipment. And we have the goal of providing 40% of all the prenatal vitamins in our country because we have so many kids who born with problem and having complications just because the women doesn't have the folic acid and the iron. So we will be happy to work with any entity who will provide this kind of medicine like prenatal vitamin to us. I mean, we are more than welcome. Actually, we asking Restorative Vision more glasses. I don't want to tell you the number here because I get in trouble, but we are pushing on Restorative Vision to get more glasses to us. We want the people in the Dominican Republic and Haiti live well with generosity. It's what we are trying to do.
Thank you for the work that you're doing, everybody. Moises Sifrin, thank you, Moises. Actually, I'm going to skip over Koenig because I'm going to come right back to you because I want to draw on this thread of collaborative partnerships, if that's all right, Simrana, because that makes good sense to me, if that's okay. Particularly thinking about cross-sector collaboration. So with some thoughts on that, please welcome up Simrana Yasmin. Welcome, Simrana. Yeah, and you've got a mic on the podium if you need it. Yeah, great. Yeah, it's up there, yeah.
And Carl's gonna. Okay. Good afternoon, everyone. Thanks, Helen. Thanks, Ollie. Thanks to my fabulous co-panelists for the opportunity to be here with you guys and just share some learning from some of the work that we have done in terms of activating cross-sector collaboration, particularly in context of improving access to eye care for children. But before getting into the nitty-gritty of our school health integrated programs, I would like to acknowledge the contribution of our partners, without whom we would not have been able to do the work that I'll be sharing with you. So particularly Ministries of Education, Health, Finance, and Planning in Pakistan, Liberia, Mozambique, and Nigeria. All the relevant provincial and local departments who have been engaged in the process, our non-government partners at the national and provincial level, organizations of people with disabilities, communities, and most importantly, the teams on the ground. And at the same time, without the financial support of the Waycare and Irish Shade, we would not have been able to do this work. For some of you who might not know about Sightsavers, a little bit of who we are. International Development Organization, we are working in 33 countries in Africa and Asia, and our vision is of a world where no one is blind from avoidable causes and where people with disabilities can participate equally in society. And what we do through our programs is protecting sight, fighting neglected tropical diseases, and ensuring that our programs have a very strong component of disability inclusion. How we do it, our program strategy focuses on 3 key areas. It's all about ensuring that our programs are contributing towards system strengthening based on evidence, and then using that evidence and learning to influence the policy change at the national level. And I'll talk about these things in detail in a bit. I don't think that I need to put any emphasis on this point that why do we need to focus on school health integrated programs. We know that children need healthy eyes and vision to develop and thrive. And if they struggle to see, they are going to struggle to learn. And there are millions of kids with visual impairment and no access to eye care and spectacles and other assistive products, and that is hindering their progress and participation in society. And within that, then there is a very strong component of gender gap. We know that more girls are affected when it comes to vision impairment, and they have less access to eye care. And lack of eye care services, particularly in context of underserved communities, has long-lasting sort of impact when it comes to negative consequences. So our approach is simple when you look at these 5 key areas. When it comes to children, particularly school-age children, it's all about ensuring that how we can facilitate cross-sector collaboration within ministries of education, health, finance, and private sector. And then, as I said earlier, most importantly, communities. I would like to emphasize when we talk about refractive error, in most of the instances, it's all about ministries of health. But when it comes to school health programming, the ownership lies with ministries of education. And in that scenario, the role of ministries of health, Department of Health is more of a complementary. Second area focuses on strengthening the capacity of all the stakeholders, just to make sure that these programs are then locally owned and well integrated into the system. Third area focuses on supporting the integration and provision of eye health, refractive error, and deworming services to school-age children. We try to see what other conditions we can integrate into our programs, just to make sure that we have a holistic sort of approach. And in going forward, we are doing to do that more and more in terms of including hearing impairment and assessment into our programs as well. Fourth approach is promoting social behavior change. We believe it's not only about providing glasses. Unless children are using them and complying with that usage, they are not going to be able to get benefit out of it. So positive social behavior change and having really strong referral pathways are really important for us to ensure the continuum of care. And then, as I said earlier, generating evidence and learning so we can go through the process of adaptive management when it comes to our programs, and that then help us to influence the policy in the right direction. The learnings are huge. I'm just going to pick 3 which I feel are the most critical ones when it comes to taking these services to scale. I think it's critical that we institutionalize eye care services for school-age children within the government sectoral plan, along with the right resource allocation and utilization. It is really important to make sure that right sort of investment is available. We know that it can be challenging when it comes to prioritizing investment, but as mentioned earlier, financing is the key for us to go to scale. And the third area is how we can make sure that we are accelerating access and scale until and unless, and we won't be able to do that until and unless the communities are part and parcel of it. So working closely with community networks, strengthening their capacity can be a game changer when it comes to taking refractive error services to scale for children. I'm going to leave you with these 3 key takeaway messages. It's all about, when we talk about best practice, think global, but when it comes to ownership, I strongly believe local ownership is going to be the key for integration and scale. We've been talking about collaborative action since yesterday, so yeah, that is going to help us to improve access, but at the same time, it's going to help us to make sure that we are reducing stigma and gender gap when it comes to access to care for children. And last but not the least, we need to be creative, we need to be innovative. That is going to help us to tap into the resources from other sectors, and so we can increase access to eye care services for children. With that, thank you. I still have 7 seconds or 6 seconds. Thanks so much for the time.
Thank you, Simrana. Please. Thank you very much indeed. Simrana, very quick questions. I was very drawn by that idea of social behavior change. Have you got an example you could paint of that, just to get us even closer to what that could mean in practice? I'm putting you on the spot.
No, not at all. Thank you. Is it on? Okay. Yeah. as I said, it's not about just giving classes to the children unless they are not using, unless they are using it. So as part of our programs, we have our social behavior change toolkit that we utilize a lot. And starting point for us in that space is identifying our target audience in a particular program or a community. What do we want to influence in terms of behavior? Is it going to be focused on girls? It is going to be focused on parents, teachers, policy makers, and having those clear questions in place then help us to design the strategy for social behavior change.
And I guess we're wondering, what's an example of the social behavior change that might then be affected as a result of that framework?
Yeah. Okay. So I'll pick the example of where we wanted to encourage young girls and young boys as well to start using the glasses. So in our program in Liberia, we managed to, while working very closely with school management, develop these school health clubs. And within those school health clubs, and those school health clubs just not focus on eye health, it's broader nutrition, deworming, eyes, hearing, and identifying the kids who can be the champion to the cause, encouraging other kids to take those messages forward, creating really nice pictorial sort of material to convey the messages when it comes to using your glasses, regular eye examination. It's going to help us do this 1, 2, 3 key areas
really
where we need to focus on.
So my mind is already spinning, and we've only heard from Moises and Samrana and of course Pelin. So what I think we should do is, I'm going to invite Coney up in a minute, but then why don't we just take literally 10 minutes into our session for your questions, because we'll get in some questions, and then I'll introduce our next 2 contributors. Is that all right? Because hopefully, Coney, you can help us build on this idea of collaboration, especially with governments and with private sector as well. So the lectern is yours. I've got a clicker for you if you need it. Ladies and gentlemen, Coney Palos. Welcome, Coney. And just to say, we're on channel number 1. Thank you, Coney.
Buenas tardes. It's okay? Okay. Ok, bueno, hablando, como ya mencionaron, de financiamiento, el modelo, para entender el modelo de Ver Bien en cuestiones de financiamiento, lo que tenemos que entender es cómo es que surgió Ver Bien para aprender mejor. En 1997, la SEP, que es la Secretaría de Educación Pública, liderada en aquel entonces por el licenciado Limón Rojas, hace un pequeño estudio y se da cuenta que el 12.7% de los estudiantes necesitan lentes. Y él fue, cuando fue niño, alguien que sufrió el tema de padecer errores refractivos y no saberlo. Y él fue alguien que fue testigo de que unos lentes cambiaron su desarrollo en el aprendizaje. Entonces, él sabía que tenía que hacer algo, pero no estaba dentro de sus responsabilidades como Secretaría de Educación. ¿Y qué fue lo que hizo? Se reúne en 1998 con un grupo de empresarios y de ahí surge Ver Bien para aprender mejor. El objetivo de Ver Bien para aprender mejor es brindar atención optométrica a niñas y niños de escuelas públicas, primarias y secundarias, para detectar errores refractivos y donarles un par de lentes de forma gratuita a todos aquellos que lo requieran. El modelo de financiamiento es así desde el inicio. Los gobiernos locales pagan el 50% del costo del lente y el otro 50% lo paga Ver Bien para aprender mejor. Esto con una idea de corresponsabilidad, ¿no?, entre las autoridades y, en este caso, la iniciativa privada. En todo este tiempo ha funcionado de esta manera. Al principio éramos un fideicomiso, ¿no? En donde obviamente los estados hacían el trabajo y solo se volteaban al fideicomiso a pedir que se pagara el porcentaje de las facturas que les correspondía. Y un par de años después, estos empresarios dijeron, bueno, ¿y cómo sabemos realmente que lo que estamos pagando se está haciendo? Entonces se decidió hacer una oficina central aquí en la Ciudad de México, con la idea de tener un control, uno administrativo y otro del trabajo que se hacía en cuestión de atención optométrica. Entonces ahí se empezaron a contratar optometristas para hacer el trabajo en campo, y desde ese día trabajamos de esa forma, ¿no? Hoy nuestras oficinas están aquí en la Ciudad de México. Tenemos una plantilla de optometristas entre 35 y 38 que están todo el año viajando alrededor del país, y el gobierno local firma un convenio por $1 millón y nosotros tenemos que conseguir el otro $1 millón, ¿ok? Eran grandes los retos, ¿no? Porque lo que había que crear eran alianzas donde, por un lado, los gobiernos estatales estuvieran dispuestos a pagar ese 50% del costo del lente, donde estuvieran dispuestos también a cubrir los viáticos de la brigada, es decir, nosotros movemos a los optometristas de la Ciudad de México al estado en donde se vaya a desarrollar la brigada, pero los alimentos, el hospedaje y los traslados internos los cubren los estados, ¿ok? Y obviamente hacer todas las gestiones en la estructura educativa, ¿no? Porque nuestro contacto en la gran mayoría de los estados sí es la autoridad educativa del estado, pero en algunos otros se hace por la de desarrollo social y en algunos el DIF, ¿no? Que es el de protección de la familia. Pero en general son las autoridades educativas, y así sea la entidad que sea, siempre tenemos que tocar la puerta de la autoridad educativa porque es la que tiene la estructura, ¿no? Para que nos puedan dar el acceso a todas esas escuelas. Estamos hablando de un aproximado de 8,000 escuelas anualmente, ¿no? Entonces es un número muy, muy grande y necesitamos tener el apoyo del gobierno justamente para abrirnos las puertas. Luego, otro punto que también es bien importante es la detección gruesa o el screening, ¿no? Realizado por los maestros. Eso también nos ayuda muchísimo para que a la hora que lleguen las campañas con los optometristas, el trabajo fluya muchísimo mejor, no sea muchísimo más rápido. Y el último punto, y no por eso menos importante, creo que es uno de los más relevantes, es renovar esa alianza cada año, ¿no? Cada año y cada cambio de administración, cada cambio de administración, porque en estos ya 26 años hemos pasado diferentes partidos políticos, diferentes colores, diferentes administraciones, y siempre hemos estado ahí, ¿no? Y creo que habla de que el programa que nosotros tenemos es algo muy noble, lo que hace fácil, ¿no? El que los estados lo acojan y lo hagan parte de su proyecto. Pero aún así, el trabajo, cada vez que hay un cambio de administración, ya sea a nivel federal o a nivel estatal, es muy complicado, ¿no? Porque muchas veces crees que ya tienes la puerta abierta y te la cierran en la cara, ¿no? Y entonces tienes que buscar otra vez por dónde entrar. Pero bueno, esto es para conseguir el apoyo de los gobiernos estatales, pero necesitamos el otro 50% que lo obtenemos de donadores privados, ¿ok? Aquí de los retos que tenemos es que la aplicación de ese recurso sea flexible, ¿no? Es decir, que el donativo no venga etiquetado para algún estado, porque cuando está etiquetado para algún estado se vuelve muy complejo, porque si no tienes el convenio con ese estado, pues va a ser muy difícil llegar a poder cumplir con las expectativas del donador. Entonces, eso es un reto, pero hemos logrado llevarlo adelante, ¿no? Renovar, obviamente, anualmente estos donativos y cumplir con lo que el sector exige, ¿no? Que es un fortalecimiento de la organización, una generación de evidencia, un enfoque basado en derechos y, obviamente, lo que ya se ha mencionado, ¿no? El tema de los ODS y la Agenda 2030, que es sumamente importante. Aquí tenemos, ¿no? Como a la par de que se obtienen los recursos Por un lado se hace la planeación de la brigada, por el otro lado la detección gruesa que hacen los maestros. Se realiza la brigada, se hace la producción de lentes y se entregan los lentes directamente en la escuela, ¿no? Y aquí nada más para cerrar, estos son los números que tiene Verbien al día de hoy. Son 26 años de trabajo, más de 17 millones de exámenes optométricos realizados alrededor del país y más de 6.3 millones de niñas y niños beneficiados con un par de lentes. Muchas gracias.
Amazing. Fantastic. Thank you, Coney. Please. Coney, just very briefly, and by the way, I've got a couple of questions for Coney, and then I'm going to ask you all for whatever questions have come to your mind for any of our guests who have spoken so far, and then we'll hear from Matthew and, of course, from Jacqueline. Coney, would you tell us something about the types of private sector organisation that have supported you, especially in recent years? Are they from particular sectors? Are they particular size of company, for example?
¿Me escuchan? Sí. Ok, los principales donadores, algo que también es importante mencionar es que de nuestro pool, digamos, de donadores, que es una plantilla a lo mejor de 17, la gran mayoría son donadores con los que tenemos ya muchos años trabajando. Tenemos ahora recientes y son de sector óptico, por ejemplo, tenemos organizaciones internacionales. De esos donadores hay donadores internacionales y nacionales. Hay, hablando de compañías en México, pues hay de todos los sectores, ¿no? Hay desde tiendas de autoservicio, bancos, tiendas automotrices. El sector es muy amplio, no hay un tipo al cual podamos sepamos que tengamos que ir a tocar la puerta, ¿no?
And I think, Coney, there'll be other questions for you. Do you have a sense of which budgets that contribution is coming from the company?
Amount?
Not the amount so much, but please tell us.
Okay.
For them, is it philanthropy? Is there a business benefit for them? How are they allocating it?
No, son donativos puros para el beneficio de los niños, ¿no? Ellos saben y a ellos les resulta muy interesante saber que tanto para los gobiernos estatales como para los donadores privados, el dinero que ellos nos entregan se duplica, ¿no? Porque hacen el 50% uno y el 50% eso les parece como muy interesante, porque por menos cantidad ellos pueden dar mayor beneficio, entonces se les hace muy muy atractivo.
Yes, of course. And congratulations on your survival over those many years as well, and many different governments too. In the UK, we have a new Prime Minister every season. It's very exciting. We need your advice. Who's got a question for one of our panels so far? Something that struck you? I see that offer there. I'm looking around our space here. And at the back, can I race around? Would you mind going to the back first? Thank you, and then I will come back to you. Feel free to say who you are, and you don't have to. Welcome.
Thank you. I'm Luz Maria Ortiz from Chihuahua, Mexico. And I like to ask Ana, in that program of Ver Bien para Aprender Mejor, shouldn't it be a good idea to include education so children can be a way to teach about eye health to the whole community? I think that might make a big thing, a big change in the world.
Sí, creemos que el tiempo que tiene el optometrista con cada uno de los alumnos es muy poco, ¿no? Entonces la información que le puede brindar es, por ende, muy poca, pero es crucial para el tema de salud visual. Lo que hemos platicado últimamente y de lo que nos hemos dado cuenta es que sí tenemos que reforzar el tema de la conciencia, ¿no? Porque en ese momento te enteras que necesitas o no lentes, y si necesitas te los van a entregar en un par de semanas. Pero después, ¿qué es lo que sucede? ¿No? Pues sí, ya lo sé, pero si el niño le gusta el fútbol y no los usa porque se le caen, por ejemplo, pues no tiene ningún sentido. Entonces, sí estamos conscientes que tenemos que hacer un trabajo importante en temas de concientización, ¿no? En los niños, en los padres de familia y en los maestros, ¿no? Es increíble, de verdad, los comentarios que escuchamos por parte de los padres de familia en relación a los lentes. Entonces, sí es un área de oportunidad que tenemos que en algún momento nosotros explorar, pero por lo pronto estamos como enfocados a lo que hacemos, ¿no? Como tal,
Yeah,
¿no?
understood. Thank you, Kenny. Thank you. Another question or reflection from the middle here. Thank you.
Sí, gracias. Una pregunta también para ti, Connie. Soy Kevin de la Brenda Strafford Foundation y hemos tenido situaciones con gobiernos que tenemos un acuerdo firmado y el gobierno cambia y el acuerdo se cancela. ¿Qué es tu estrategia para asegurar que cada vez que hay un cambio de administración que sigue este acuerdo que tienen con el gobierno? Gracias.
Pues es una pregunta complicada de responder porque no creo que haya un camino, ¿no? que sea así como paso 1, paso 2 y paso 3. Lo que sí creo y estoy convencida es que si tienes evidencia de que tu intervención funciona, es muchísimo más fácil convencer a las autoridades, ¿no? Y yo creo que lo más importante es no darte por vencido. Realmente es tocar la puerta y te la van a cerrar no una, quizá varias veces, pero vas a encontrar a alguien a quien le resuene lo que le estás diciendo y sea él el que te ayude a abrirla. Pero sí creo que la evidencia, el tema del impacto y la medición creo que son cruciales para justamente tener una evidencia robusta de que lo que estás haciendo funciona y que lo que estás pidiendo no es un donativo, es una inversión, ¿no? Eres una empresa para invertir socialmente. Creo que eso es el cambio que tendríamos que ir haciendo todos, ¿no? Para que fuera mucho más sencillo.
Thank you, Kenny. We might just have time for one more question before our next section. I see an off. Actually, why don't we just do two? Just here, thank you. And then, gentlemen, just on this far block here. We'll take the pair.
Can I say something? I would say something. Su pregunta del gobierno. He make a question about the government change when we have an agreement. Something that have been working in my country. When you make a trade with a government, don't be too friend with the one that are in power, and share the credit. Then the other one that come and be in power, he not going to remove what you are doing. You have to share the credibility so the community see the new government helping the kids. But if you don't give them the credit, they will come and wash out all the agreement you make with the one that was in power.
Yeah. Thank you, Moises. Just quick one here, and then just on that far side, please.
Hi, I'm Fiona Lawless. I work at Sightsavers, and I just kind of wanted to come back a little bit to actually what nearly everyone has spoken about, but particularly the target that Pelin mentioned at the start, which was that 40 percentage point increase in effective refractive error coverage. And I guess to achieve such an ambitious target, we need to do similar to what Samrana was saying, which is about cross-sectoral collaboration and look outside of ourselves and our own sector. And we also know the challenges with data for monitoring that. So I guess in order to form this into a question rather than just a statement, do any of the panelists have a particular insight as to how we can bridge that gap with the data collection as well? That if we need to move beyond just kind of programmatically, but look towards government collecting their data, how do we move beyond that?
Good. Well, let's give a hospital pass to your colleague then on that. Samrana, say, tell us something. Is there a particular data set you would like access to that you think would help scale this up? Because half the challenge is the data you haven't yet got, right?
Yeah. I strongly believe in strengthening the health and education information management system within the government system. We know that, particularly in the countries where we work, this is one of the weakest area. And there are significant gaps within the capacity of certain stakeholders to identify the indicators that need to be collected. Secondly, agreeing on those indicators which needs to be finalized and get into the system. Thirdly, collecting them and then analyzing it. There is no point in having data if we do not have capacity to analyze, learn from it, and then make our programs and services better. So I would say within our programs in the countries where we are, looking at where those gaps are in terms of indicators, and then working with national level stakeholders to make sure that we are including them into DHIS2 when it comes to health, education information management system, when it comes to programs like school health, and taking it from there, and making sure that when we design our program, there is significant component along with resources to address that gap. Because at times, just making sure that we are reaching in context of services and then products, we miss on these allocating right resources for these sort of areas which are going to help us to achieve that 40% point
Thank
increase.
you. Now, what I'm going to do is promise to come back to our colleague over here after our next session. But Helen, did you want to build on that at all? From that? And of course, Jacqueline, yes. Well, why not Jacqueline first? Go on.
Okay, thank you. And I agree 100% with what Simrana just stated. And I think there's a direct correlation between the previous question about governments changing and if they're not as supportive as the previous government in terms of eye care initiatives. So in terms of the data collection, the more data that you can collect from all of the entities that are out there doing this great work and funneling it into the information system of the government, the better, right? And then that will allow you to be much more persuasive, influential, helping to raise awareness of the facts that are happening out there, the good work that's happening, and the resulting wakes that occur after that, by helping so many people. So they tie in directly. So the more data you have from more parties doing the work that's factual allows you to influence better, which thus should allow you to have more success in moving the needle with the governments and funding the programs, all of it. So that's a great question, and it ties in, to me, full circle what we're trying to achieve.
Yeah. Thank you. Helen?
And then just to quickly build on that, first of all, that was an excellent question. I'm so glad that you raised it because we really do need to be talking about this 40% point increase. It's quite substantial. I would also say that within the sector, we have to create a culture of sharing. There's been a lot of information withholding. And so I think to openly, for the NGOs that are there, to be sharing the work that's being done, because we know that there's great work being done at the level of governments. There's also great work being done with NGOs of all kinds in Restoring Vision. We're working with the Africa Christian Health Association's platform that reaches 32, soon 33 countries. And there just has to really be this sharing. And I think if we do that, as we all work on the data together, we're going to understand the numbers better. And we're going to understand where the successes are and where the gaps are.
Definitely on that power of collaboration. Thank you, Helen. So we have got a bit of time for more questions later, and we'll come straight back over here for that. But I want to have somebody join us from afar, and that somebody is a very renowned economist, especially on the economics of policy making, markets, regulation, always interested in Matthew Bell's latest thinking. So with luck, we can beam him in to our summit here, and we will be hearing from him shortly. Everybody, here comes Matthew Bell.
And greetings from London. I'm very sorry that I cannot be with you today, but I would like to welcome you all to this part of the session. My name is Matthew Bell. I'm a director at a company called Frontier Economics, and we've been appointed by the Coalition for Clear Vision to carry out some work into ensuring and helping to promote the development of glasses for everybody. The work that we've been asked to do has been in two phases. The first phase of the work that we've done has looked at the barriers to the wider distribution of glasses. And the second phase is then to look into specific elements and specific barriers and try to come up with some solutions. I'd like to spend a little bit of time taking you through the conclusions that we've drawn from each of those two phases of work, and then to talk about the next steps. In order to do that, I'm going to share some slides. So as I said, the first phase of work looked at key supply-side barriers to improving the provision of glasses. We focus very specifically on the supply side. We're very much aware that there's a lot that requires doing on the demand side in terms of educating people and making sure that things like the stigma associated with glasses and the importance and the difference that glasses make is needed and continues to be needed and valuable. The gap that the Coalition for Clear Vision saw and that we have been trying to address, though, in the evidence base and in understanding what to do, has been more on the supply side. And in phase one of the work, we looked at the whole supply chain from manufacturing through transport, distribution, optical labs through to retail in order to understand the types of barriers that arise at each point in the supply chain. We also looked at the breakdown of the costs of providing glasses, looking at the costs in the retail sector, which are the largest proportion of all costs, and depending on the types of glasses and the types of market, may even be a larger proportion than that shown in the pie chart here. We looked at the costs of production, often in China, clearly, the costs of import, often bringing glasses into countries, frames, lenses, and the cost of distribution and marketing, which are a very important part of then making sure that glasses can reach their final users. We noticed, and the evidence base that we collected based on a whole series of interviews and discussions with people, a review of the literature, a review of findings of expert reports, and so on, a number of barriers that cut across each of those areas. Barriers about how glasses are regulated at the point of sale, issues to do with how new business models and entrepreneurs can get their retail businesses up and running, and barriers related to import tariffs and frictions as glasses come into countries. The second phase of work sought to look at those barriers in more detail and think about how to overcome them. And in particular, again, to emphasize the fact that part of those barriers clearly sit on the demand side, and the work needs to continue educating people, educating government officials and others about those barriers. Also, we're very conscious of the big role that charity, philanthropy, in helping to deliver and overcome the barriers to wider access to glasses. However, what our research also showed, and what came through loud and clear, is that this problem, as one of our interviewees said, cannot just be solved through philanthropy. It will also need business solutions to take it through the finishing line in order to try to make sure that glasses are available to the widest number of people possible. And in order to do that, our work has developed a sort of toolkit that the Coalition for Clear Vision could take forward into the future. That toolkit starts with a diagnosis of countries. And here you see a standard, if you will, diagnosis of the business readiness of countries based on the types of institutions they have, the infrastructure that's in place, the way the labor market works, financial systems, the size of the market and demand, innovation, the ease of innovation, and growth into the future. Our work and our more detailed report, which will be available a bit later, then applies this set of indicators, this diagnosis framework, specifically to the market for glasses. And we develop indicators and look at indicators that will allow yourselves, others, the Coalition for Clear Vision, to diagnose which countries are at which stages and what the appropriate measures will be then to overcome the barriers in those particular countries. Our work has also articulated some specific measures that then, once we've prioritized which countries to look at, would then be worth diving into in more detail. And in particular, overarching themes that the Coalition for Clear Vision could look at about articulating the vision for the sector, about convening providers to deliver that vision, and helping to provide evidence, methods, training for the appropriate regulation of the sector, convening stakeholders from the countries that are the focus for immediate action. We've also looked at specific solutions to overcoming the barriers. That includes work on access and innovation, supporting the acceptance of new technologies, convening new technologies, and changes that might need to be made to regulation, for instance, or other areas to enable new technologies like telerefraction, online diagnosis to make a difference and to allow delivery. And also the coalition's potential role in building access to networks, to new demand centers outside of traditional retail settings, such as in schools, in public institutions like hospitals, and being a voice for smaller providers in those situations. We've also, as part of overcoming the barriers to entrepreneurialism, started to develop solutions around provision of external finance to support working capital and models that will make the supply of glasses lower cost, such as master distributor models, whereby bigger hubs can be used to service smaller retail outlets at lower cost, making sure that the range of products needed is available. The coalition can play all of these roles, can help support all of these roles, and in that sense provide a path forward to supplying glasses to a much larger proportion of people. We hope that our work will help to catalyze more thinking and more development of supply-side actions to complement the education on the demand side. And these supply-side actions covering the types of issues that I've been talking about today. We are going to be delivering a more detailed report during the course of July to the Coalition for Clear Vision, and very much hope that we'll be able to discuss that with you when it is available and take forward this important area of work. Thank you very much.
Well, thanks to you, Matthew Bell. That was first time. It's giving me flashbacks. You know, I co-founded Startup Britain with 10 Downing Street only 5 or 6 prime ministers ago. But all of the funding came from the private sector. But my co-founder founded Glasses Direct. So if only I'd met you sooner, Helen. Course of UK vision could have been very different. I wish Matthew was here for us to grill him, but I'm going to ask Jacqueline to do something extremely unfair, which is talk us through some highlights of the Coalition for Clear Vision, but in about 8 minutes, if that's all right. Ladies and gentlemen, Jacqueline Grove. All right. Thanks, Jacqueline.
Hello, everybody. First off, I just want to thank Restoring Vision and Palin for putting the session together. It's been an honor to sit up on stage with these phenomenal leaders, and I'm here to talk with you today about the Coalition for Clear Vision. First off, I just want to give you a highlight, an overview of the coalition and some of the purposes of it. As you can see here, we focus on the development of strategies, both local and national, and we do that through using alliances and collaboration with many different organizations in the optical ecosystem, both on the global level and at the country level. So you've heard that as a theme today. I think if you were to take one thing away, the power of collaboration is super critical. The coalition also creates evidence and know-how for the development of enabling the environment. So that really ties into the work that you just heard about with the Frontier Group, which I'll talk a little bit more about. And additionally, we have 2 key focuses for the coalition, 2 avenues that we pursue. One is we have a global coalition that we look at broad-based opportunity areas for the sector, which I'll explain and get deeper in a moment. And then we also have a country-level coalition, which we operate out of Kenya. So I'll dive into both of those areas. There we go. First off, we talked a little bit about the benefits of a coalition, and I want to dive a little deeper into that because this isn't just the benefits of being a part of the Coalition for Clear Vision. It's really about what are the benefits of being a part of a collaborative coalition. It doesn't have to be TCCV, although if you are interested in that, come and see me and I have information I will give you. But there's a lot of power in this. So the first is, I'll just give you an example of Kenya. Kenya has right now a total of 20 members that is very diverse. It's NGOs, it's faith-based organizations. We have the public sector, Ministry of Health, and some public officials that are in there. We have associations and agencies that are a part of it. Every month, we have meetings with them, and we talk about where they're doing their business, right? What areas of Kenya are they focused on? What kind of work are they doing? What kind of results are they getting? We collect all that synthesize it, and we deliver it to the Ministry of Health. During the course of all that, the members get to know one another. So, I mean, one of the things I think one of the panelists said was the power of making sure that we're sharing, both sharing data and sharing our best practices with one another and building relationships. And that just doesn't come by accident. And the power of the coalition is that as they gather, they meet monthly, they build relationships. We're much more, as humans, apt to share more when we have a relationship with someone. And that's really what the power of the coalition is it gives a nice streamlined process to government, with a one-stop shop for delivering results and helping them to understand the impact that we're making and some of the gaps we may have. And it also builds up our coalition as a sector to be able to move results forward, which is what we need. In my opinion, it's one of the most critical factors in our success is our ability to all work with one another. This overviews the members currently of the Global Coalition. You'll recognize many of these names here. We're very honored to have every one of these folks that participate in our calls. Many are on the steering committee as well, but I just wanted to share that with you. That's our Global Coalition. And I want to talk with you now about a little bit of the work that we're doing, first off with the global, and then I'm going to get a little bit more into Kenya. So we just heard from Frontier Economics, and we actually were riveted by the Phase 1 report that basically geared a look at the private sector and what barriers were in place to create a thriving private sector. And the report found that those barriers were supply chain, specifically tariff reduction, customs time frame reduction and simplicity and training in that area, a regulatory environment. And the Global Coalition, and one differentiating thing about it, it focuses on the private sector. If you think about any organization that's out there, there's few that focus solely on private sector. It's probably one of the biggest knowledge gaps we have in the sector is representatives that have private sector knowledge that are helping us do the work, along with just our own understanding of how do we overcome some of these big barriers. And as Matthew stated, we're not going to reach the goals we want to achieve without the private sector. There will always be a place for NGOs and philanthropy, and obviously we have to do it with affiliation with public sector, but it also has to include a thriving private sector. And if we leave that part out, we will never reach the numbers or the sustainability that we want to have as a sector. And I think that's a really important paradigm shift for our sector as we're marching towards the goals that we have. We just can't do it with just NGO and just the public sector. The private sector has to be a part of it. One of the culminations of the Frontier work is a heat map, if you will, that lists out what conditions need to exist for a thriving private sector. Those were the graph that Matthew showed. So these will be a map and analysis that we use. We're going to start off by overlaying it on Kenya, and then what do we need to do to overcome those barriers? And that's the key. That's the things that we struggle with and that we don't have a lot of knowledge with. So over the next 6 to 12 months, that will be the activity that we do in Kenya. Once that is completed and we get the learnings, we'll start applying it to other countries, again, making it a sustainable activity. And then we do complementary work with the WHO, focusing on the private sector. We see that we're going to help to support and guide some of the private sector activity with the WHO and to support SPECS along with the IAPB initiatives and other groups that also work in the private sector. So that was the Global Coalition, and now I'm shifting gears now to the Kenya Coalition. As I had stated before, Kenya has right now a group of 20 individual organizations that is very diverse. And you also heard that from a couple other panelists, is the importance of not just having NGOs or not just focusing on public, but you really do have to bring in faith-based organizations, associations, and get everybody involved. And I would really challenge everybody. The collaboration comes in a lot of different forms. So if you're collaborating with a couple different groups, that is fantastic. But think broader in who else needs to come, right? Who else is doing work in the areas that you're focused on, and how can you invite them in to complement the things that you're doing and work as an even stronger collaboration? And that's what we're trying to achieve in Kenya. If you're doing business in Kenya and you're not a part of the Kenya Coalition, I would love to talk with you, because one of the things we're trying to do is rally everybody that's doing work in Kenya and really leverage that again for the purposes that we talked about, to be able to take to the Ministry of Health a full, complete picture of the work that's happening and also the gaps that might exist in that country so that we can move it forward. Our goal in Kenya is to create a success story in a country that has a lot of need. As many of you know, there's a 9% coverage rate in Kenya. It's very opportunistic. There's 50 million people that live in that country. And we want to create a success story with Kenya where we show this is a country through collective efforts of so many diverse parties working together towards a common goal that we can actually hit not only the 40% increase in coverage rates, but go well beyond that. And once we do that, we're going to repeat it somewhere else and do it over and over again. And that is what sustainability is. And good, and I have 16 seconds. So this is my contact information. If you have any questions or you want to talk, I'll also be at the reception tonight. And, we have a lot of collective power in this room and in our sector. And recently when I attended SPACs, Alarcos had a quote that I just want to finish with, which is the only way that we can predict the future is to create it. The only way we can predict the future is to create it, and that's what we're trying to do, is to create the future through the actions we do today. So thank you very much.
Thank you, Jacqueline.
Let the grilling begin.
Let the grilling begin, you know it. Thank you so much. Well, I've got a quick question. With the Kenya example, you said how you'd become a liaison between the NGOs and the government. So what have you learned around when you're being that liaison, when it's helpful to have or speak as one voice versus when you just have to embrace the complexity and share the nuance of the many different perspectives? Because it must be tricky to pick one of those approaches at the right time.
So our country leader, Elizabeth Muchaki, I think the first step to answer your question, like if you're a coalition leader, you have to really spend time talking with the members and having, your ear to the ground, your finger on the pulse. And you're right, there are different views that some of the groups will have, right? Your goal is to synthesize those different perspectives and to understand and validate, what points of views are out there, and to take that information to the Ministry of Health. And if you have a larger voice that has evidence and results and things that back it up, you may more prominently take that in, because obviously that's going to help you to influence. So there's really no set answer to that, but I would say the basis of it is that as a leader, you have to have a good relationship and understand where the people in the coalition are coming from, and that does create the camaraderie that we talked about.
Really powerful fundamentals. So, slightly more playful question. It strikes me that lots of social breakthroughs come through unlikely alliances. People that you might never have thought might work together, and yet they thrive together. Is there a type of organization you at the coalition would like to work with that isn't yet at the table? We'll beam it out from this center.
So that's a phenomenal question. And so I would say that what we're trying to find right now are individuals outside of the vision sector. We really feel, again, diversity and the inclusion of people who are like-minded and they want to do good work and they're passionate about eye care. They're not all working in the sector. Some of them just need to learn more about it and have transferable skills. Specifically, I would say that where I would love to have some expertise in and outside of the sector would be in the marketing side, because the whole awareness and demand generation, especially in Kenya, I think is very critical to our success that we're going to have.
Okay, so marketeers of the present and future, we need to talk to you. Okay, let's take in some more questions and reflections. I did promise, if it still stands, was that the offer that was there earlier? Yes, welcome back. Thank you for your patience.
Hi, my name is Raghu Gulapalli. I'm with LV Prasad Eye Institute in India. If the goal is to close the gap in refractive error by 2030, which must, and while much has been discussed about supply chain, funding, data, etc., I look at this as fundamentally a human capital problem, right? What strategies and initiatives do you have in place to build and strengthen local capacities, including training local healthcare workers and establishing sustainable eye care infrastructure, to ensure long-term success in addressing the vision crisis in these underserved regions?
A human capital problem. Who would like to start off with that? Just make an offer. Samrana, can we come to you? And then Pelin, feel free to build.
Happy to take a stab. Completely agree. Whenever we talk about what is going to help us to change the landscape of eye care, the first thing that comes to my mind is people. And from our perspective, I think I highlighted the fact that the way we work is ensuring system strengthening, and within that, working very closely with governments when it comes to health, and seeing how we can support their different cadres who are working in eye care from community, primary, secondary, tertiary level, and building their capacity, identifying the gaps, and then building their capacity to take that forward. I'll just pick an example from Pakistan. One of the gaps that we have faced throughout was how we can ensure dispensing of glasses through a qualified cadre. Right now, when it comes to optical services, it's primarily in private sector, and there was not a government accredited diploma course or any other training program that help us to create the right human resource to provide those services, particularly closer to communities, and ensure that access and scale and access is there. So working very closely with Ministry of Health, and we managed to develop a 2-year diploma course for Pakistan's first ever, that is going to help us to create a new cadre of dispensing optician, and that is then the next step for us is, which we have already started working on, is to creating those positions within the public sector to strengthen that component of refractive error work.
Thank you, Simran. Now I'm just going to cut you briefly there. Jacqueline, come in, because then I do want to get more questions in, because we're going to run out of time. Forgive me.
I'll just also build on what Simrana said. I think the ecosystem of our sector is going to need to play a key role in that as well. And what I mean by that is we have these wonderful organizations. We've got WHO with SPECS, we've got IAPB and the work they do, the United Nations, and other various key groups that are very influential. And I think their ability to work together as they're pursuing these initiatives is going to be very critical, as well as inclusive of the private sector again, because some of the human capital, training, and all the things that you had mentioned in your question, if you have a thriving private sector, that's also going to take care of that, because they're going to do a lot of the work and they're paying for it.
Thank you, Jacqueline. Now let's get other questions in. Yes, how about right down here on the second row? I'm just scanning around. We're going to run down the clock. Welcome. Yes, just at the end here on our third row. Oh, yes, that's right. Forgive me. I blame the jet lag.
No, I'm glad you asked me first, because I just think that, I just want to make a quick comment and then the panel can comment, is that the conventional training, even with investment from private sector and all, is never going to get us to the numbers we need. Okay, we have to change the training that we engaged in. We have regulatory barriers that we need to deal with. And as many of you know, that's why we are pushing very hard that we should look at tele-refraction and such strategies as an alternative to what we're doing, while keeping the professionals in the loop, because the numbers just don't stack up. The current approach, even if all of us go back home and do as much training as we can, the numbers just don't stack up. We'll never get to that 40%. Okay. So I just want to get comment on that.
Very strong provocation there. Thank you. Pelin, do you want to pick up on that?
Sure. Thank you, Koven, for that point. I think this is where if organizations, whether it's governments, NGOs, private, whoever it is, but if we have scaling in mind, which is what the point of this session is, I wonder if some of the decisions we make could be different. And I think that's just a thought that I want to leave everyone with. At Restoring Vision, once we started, went through the pandemic, we had this urge to solve this issue area and to one day not have to exist, quite frankly. And at the top of our mind is, how do we achieve these global targets? How do we need to think differently? How do we need to think more innovatively? Who do we need to partner with that we're not partnering with? So I sort of think it's just this mindset. If we can all think about how do we scale, we may be making some different decisions.
Yeah, love that reflection. Samrana, please.
One tiny thing to add, and I strongly believe that we also need to look outside of those regular healthcare professionals when it comes to bringing services closer to communities. There are other opportunities out there that we can tap into.
Yeah. Okay, so we are going to get beaten by the clock here because I promise we're going to finish on time, so you get your tea and coffee break. But I'm going to put it back to all of our guests here. Maybe a final word, a call to action, because in our very different ways, we are very keen to scale up all of the work that we're doing. So you can be as practical as you like. You can go big picture if you like. What would be your call to action for our audience here in Mexico City? And Jacqueline, I'm going to start with you, and then we'll work our way down, if that's all right.
So I would just say reflect on the things that you heard today. And one call to action I think is always very healthy is just to evaluate if there's something else that you could be doing that could create more scalable collaborations or scalable actions. I think a lot of times we get caught in doing the same things over and over again, which is great, but we know that we have to do things differently. And I think we heard some great examples today and case studies that I think you can take a lot of things back and go and reflect and say, okay, how can I take what I'm doing to the next level and contribute at an even greater level?
And thank you for doing what you've done today by calling for experts from other industries as well. I think that's such a powerful ingredient in that. Samrana.
We are talking about scale, and I would like all of us not to lose the sight of quality of care when we are trying to achieve scale. That's really important, and then putting people at the heart of everything that we do.
Thank you. Coney.
Yo creo que ya lo dijeron ellas, ¿no? Creo que sí es importante ver fuera de la caja, ¿no? El saber que lo que hacemos lo estamos haciendo bien, pero podemos hacer mejor las cosas y podemos hacer más, ¿no? Entonces siempre buscar como nuevas opciones o nuevas oportunidades de alianzas, sobre todo por nuestros beneficiarios, ¿no? Que bien decían en la mañana que son seres humanos que tienen derecho a la salud y a una buena salud visual, ¿no?
I would say exactly what the girls are saying, but I will add that talk about what we are doing, get everybody involved, get the non-profit, business people, religion, the government. Many of the issues on the world and on the government, they have the budget. But when they see a lot of people like us, non-profit churches, working together, we can convince. And something that was very important, we was talking about data, how we can show the government and the entities what we're doing. Data change people's mind.
A question for you, Moises, on that. You very generously asked our audience which language you'd like us to hear you speak in. Have you found that you have to speak, I don't mean literally in different languages, have you found that you have to speak in different ways to different people?
Yes, like I grew up in a very poor neighborhood. When you talk to people like are on those kind of neighborhood, you have to speak their language, look like them. Like when I go to the community where we are Haitian Creole, I bring Haitian Creole, I talk in Haitian Creole to them. When I speak in English, I speak like very low kind of English. I don't use the word that I will be using like the Congress people, because I convince them way easier when I look like them. I like to do that. But in the end of my job, I believe in relationship. Everybody want to do good. Even the people who commit a crime, they have a mom, they have kids. Even if they are in jail, they don't do bad to their own people. So I like collaboration, talk, and do good to people.
Really powerful. Thank you, Moises. So, Pelin, of course, I want your call to action, but I'd also, if you wouldn't mind, I'd love your reflections on the whole session, really, because we've heard. And by the way, please join us in thanking our brilliant contributors for this session. I hope you've enjoyed it as much as I have. Thank you. Pelin, what have you made of it, and what's your call to action for us?
So thank you. First of all, I think this was really, in terms of expectations, we try to keep them sort of minimal, but this really exceeded my expectations. I think the fact that we're having a conversation about how do we scale refractive error services to reach significantly more people is such a critical topic, and I'm so delighted with all the presentations, the conversations, the questions. So we're actually kind of in the right moment. And I think my takeaway is that right now, our issue area, eye health, refractive error, it is on the global stage, and there's a momentum and there's wind behind our backs, and it's really up to us whether we take advantage of that and maximize those opportunities. I think we should be asking ourselves, how can we do more? How can we do better? Always with quality. Quality has to be there. It's a really critical element. But I'm pretty certain if we pushed ourselves a bit more and came back here a year from now to say, how many people have we reached and how are we doing? And asking ourselves, are we happy with that progress? I think that's really critical. So I hope that we'll all get to do that and partner with each other to help think better, think together, and just advance the cause in the issue area. Thank you.
Thank you, Pelin. And please, will you join me in thanking Pelin and all colleagues at Restoring Vision for their collaborative support in this session as well. Thank you. Thank you for being in this session.